Good day, folks. Alfie Vente here once again at Vente Pain Relief Clinic and VPRC.ca. I'm hoping you're having a great day. Today, this is part 2 of our soft tissue case study. Baseball pitcher has wrist pain. This is the answers and discussion portion. Previously I posted a video with the case study on both LinkedIn and YouTube. And this is the second portion where we discuss the answers and also we discuss the case. So if you are a massage therapist, if you are a chiropractor or physiotherapist, a physical therapist that loves to focus on the soft tissues, muscles, and fascia, this case study might actually be helpful for you. So with the previous video, I asked you guys to maybe write down some notes with the specific questions that I've asked. Now, if you like our content, please like, share, subscribe, and if you're on YouTube, hit that notification bell. We really appreciate it. Thank you very much. So now let's go to the soft tissue case study. Baseball pitcher has wrist pain. And by the way, these cases that I put out there are some of the treatments that I have encountered over the years. There could be a combination of different treatments that I've had, and I put them all together into one. So there is a life kind of like a life experience that I've had that I'm putting these cases to work. So let's get to the cases. So just as a review, with this case study, it's an 18-year-old male patient client who walks into your treatment room complaining of right wrist pain. This pain is dull and low grade to mid grade in degree. It is constant and has been chronic for a couple of months. There is zero swelling or any signs of inflammation to the area of complaint. They have seen their MD and have been to different specialists. They suspect carpal tunnel, but Western methods of testing show negative. They are also negative for any traumatic types of injury above the joint, such as the shoulder, elbow, and neck. And I have to also mention below the wrist, the fingers don't show anything that's traumatic. You assess the elbow and forearm relative to the unaffected side. There's slightly more tightness. You investigate further, and the patient client mentions to you that he is an elite level baseball pitcher that plays for both his high school and also for a traveling team that travels to different cities for tournaments every week. So this is a person that practices a lot, uses their arms a lot because they are baseball pitchers, because he is a baseball pitcher. He has noticed that his velocity has dropped a little and that at times raising his arm proves somewhat difficult. It feels weak. So that is a review of the case study that I posted last week or a couple weeks back on, again, both YouTube and LinkedIn. The key observations as a review: right shoulder is rounded more forward relative to the left. Palpation of wrist and forearm show minimal pain and discomfort of the right side. Some tightness of pectorals and scalenes. Although active elevation is pain-free and looks relatively smooth and within range, the patient mentions that the right side feels weak. On resistance of elevation, there is some weakness of the right side. The TOS special tests are negative. Neurotests and carpal tunnel tests are also negative. And these were the critical thinking questions that I asked you guys to write down and think about for this video that we're doing right now. Number 1, is the wrist and forearm the root or just a symptomatic location? Number 2, what structures would you suspect might be causing this issue? List in order of importance 3 structures that you could potentially treat. This could be more than 3, but these are 3 very specific structures that you would aim to treat. What is your theory as to how you came about to your conclusion? So what was your thinking process to get to what was the reasoning to get to like number 2? Question number 1, let's answer that and let's discuss that. Is the wrist and forearm the root or just the symptomatic location? As if you were to reread the case, the simple answer is no. It's not the root. It is just more the symptomatic location. There's minimal indication that point to the wrist proper, hand or forearm for that matter. There is some slight tightness, but that doesn't really indicate too much in terms of whether the problem is actually in that location or not. Carpal tunnel and traumatic injury locally have been ruled out. We mentioned that earlier with the case study. Although there is slight tightness, as I mentioned before, it is not enough to point to the wrist as the actual root. The root is somewhere else. Where could that be? So we're going to go further with the questions here. Question number 2, what structures would you suspect might be causing this issue? List in order of importance 3 structures that you could potentially treat. Now, this is what I wrote down, and this is actually things that I've applied for this sort of case study. So number 1, and I'll explain these in a little bit, subscapulars would be my first choice in terms of really zoning in on a particular structure. Pectoralis minor and major, I mean, they're 2 different muscles, but I put them down together as number 2. And number 3, serratus anterior. Now, as I mentioned earlier, that these are 3, but there's probably 4, 5, 6, maybe even 7 structures. But for myself, like, I list them in order in terms of importance of what I would like to deal with in regards to this case. So let's go to the breakdown here. Subscapularis. It's an internal rotator of the shoulder. Along with the other rotator cuff muscles, it helps stabilize the glenohumeral joint. As a high-level picture, his subscapularis is potentially overworked and weakened. So just the amount of throwing that this guy does, it really involves the subscapularis muscle, not only in stabilizing the shoulder, but also in that internal rotation movement. The overwork has brought along trigger points in the muscle. Now, regardless of what your view is on actual trigger points, as a therapist that's been working for 20 plus years, 23 years, the trigger point chart, if you've used them, helps me to figure out what direction I should go with my treatment. So regardless of whether you believe trigger points exist or not, the point is that, like, it helps direct my hands and my thinking process towards a certain area to work on. So if you look at a trigger point chart, you'll see that in this muscle, it can potentially cause weakness through elevation. So raising the shoulder, it can cause some weakness, and also pain to the wrist. In fact, I will use this muscle. I will work on this muscle. If somebody comes in and tells me, Alf, I think I've got carpal tunnel, or somebody told me I have carpal tunnel. I look at the wrist, I do a valence test, whatever, and it doesn't seem like there's anything really wrong with the wrist. But then as I poke into the armpit, the axilla, and work the subscapularis, that person usually says, wow, I feel that into my wrist. And in fact, like, when I'm working on it, when it loosens up, they'll also mention that my shoulder feels a lot looser when I reassess. Let's go on to the next muscle. Oops, we just said that. So pectoralis major and minor. Okay, I grouped them together. This is the number 2 group that I would work on, the number 2 structures. Pectoralis major is a powerful internal rotator of the shoulder. Pectoralis minor, due to its attachment on the coracoid process, if extremely tight, may draw the scapula forward, causing more of a shoulder forward position. The position of the shoulder, due to its tightness, may exacerbate future observable shoulder issues. So the position of the shoulder, what you're doing is you're trying to correct, along with the subscapularis muscle, correct the positioning of the shoulder. Because as the shoulder is more forward, there will be potential issues with raising the arm because it's in a bad mechanical position. So the idea is that you're correcting this area to help with the subscapularis and help with the positioning of the shoulder. And therefore, like, decreasing the potential issues with the wrist. So number 3, serratus anterior, which is one of my favorite muscles to work on. It is a protractor of the shoulder. It basically brings the scapula. It's actually more of a protractor of the scapula, to be more specific. As a picture, there's potentially an increase in the protracted position of the shoulder. Combined with tight internal rotators and tight protractors, the shoulder is in a mechanically terrible position. The tightness in all the muscles that have been listed, it says listed, it should be listed, can cause pain and dysfunction locally, but can also cause discomfort down the arm. So the muscles that we talked about, subscapularis, pectoralis major and minor, serratus anterior, they can all, if they've got trigger points, they can also refer down into the arm, potentially exacerbating this person's condition with their wrist. So those are the 3 structures. Now, I'm not sure what structures you would have worked on, but these are the ones. In other words, like, if you think about it, it's actually the shoulder girdle that I'm working on specifically, more under the axilla for this person's wrist pain. So question number 3, what is your theory as to how you came about to your conclusion? I'm curious to hear your answers. Please share your thought process below. It would be really appreciated. It'd be great for discussion too. So for myself, because this person is a baseball pitcher, as I mentioned before, he will elevate he will do a lot of elevation with his arm, and also a lot of internal rotation. So that's a lot of stress on the subscapularis muscle. So over and over, and what that can cause those trigger points, potentially causing pain in the wrist. And that's why this individual, like when they got tested for carpal tunnel, showed negative, negative, negative. But you will find that if the subscapularis is the problem when you're dealing with somebody with a wrist issue, they again will mention, will potentially mention that they have pain going to the hand or the wrist or into the forearm actually. So those are some things to think about if you're dealing with somebody that has a potential wrist issue and it doesn't seem to be getting any better. It could be coming up from the shoulder, specifically the subscapularis muscle. So if you got any questions whatsoever, comment below, whether you're on YouTube or on LinkedIn. We really appreciate you watching this video. Again, if you like our content, please like, share, subscribe. And as I said before, if you're on YouTube, please hit that notification bell. We really appreciate it. And also check out our social media accounts. We got some more content for you. I will have future case studies, so watch out for them because they'll be coming out in the next few weeks. Have yourself a great day. My name is Alfie Vente. Once again, of Vente Pain Relief Clinic and VPRC.ca. Take care. See you soon.